I welcome everyone on this ज्ञान सभा प्लेटफॉर्म टुडे। आप सभी का इस ज्ञान सभा के मंच पे स्वागत है। और जैसा कि हमने इस वीडियो में देखा कि दिया दैट इज डिवाइन इंडिया यूथ एसोसिएशन is a youth movement of all world Gayatri Parivar and is engaging youth into nation building constructive activities. And this Gyan Sabha initiative endeavor is a part of that nation building endeavor that we are moving ahead with. At the outset, I'll request everyone to pray for the well-being of all, particularly in these troubled times where we are in. मैं सभी से रिक्वेस्ट करूंगा कि मेरे साथ आप एक यूनिवर्सल प्रेयर बोलें फॉर द वेल-बीइंग ऑफ ऑल. We acknowledge the omnipresent, omnipotent, and omniscient Almighty. May the Almighty help us in imbibing divine values and propel all of us on a righteous path. This is, in essence, the crux of Gayatri Mantra. It is Om Bhur Bhuvasvaha Tat Saviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yona Prachodayat. Ladies and gentlemen, we are extremely honored to have with us today Dr. Randeep Guleria, Padma Shri Dr. Randeep Guleria ji, who we know from his very busy schedule has taken out time to be with us today on this platform and share his thoughts for us on this very important topic, that is demystifying COVID-19. Dr. Saab, I welcome you once again and thank you so much for taking out time. I'll not take much time. I'll just take 2 minutes to set the theme for today's talk. And very briefly, I'll set out what do we intend to do here today. So we will talk, of course, talk about COVID and the impact it has had on the entire world and our country as well, likewise. I'll briefly show 2-3 slides to uh, demonstrate what the entire Gayatri Parivar, the establishment and the youth wing have been doing to counter this, and generally what are the activities. So DSVV Dev Sanskriti Vishwavidyalaya is a university in Haridwar, and as we saw in the video, Dr. Kalam went there on the second convocation, and along with Dr. Pranav Pandya, who is the chancellor of the university, they launched a youth movement which would give youth a platform to do these nation building activities. ESVV is reviving ancient wisdom and is confluencing it with modern science, and is committed to do research on a concept called Yagyopathy. And there is a Yagyavalkya Center for Yagya Research which was established in 2018 there, and it has been doing some pioneer work in the field of Yagya, how Yagya therapy can be used along with modern science. And DSVV is working with the Department of Ayush as well. And prominently in 2016, in a health fair organized by the Department of Ayush, DSVV demonstrated um, the literature on holistic health, yoga, Ayurveda, naturopathy, Panchkarma, etc., as to how they can supplement the existing modern science and how we can explore alternative means of medicine. There have been two PhDs in Dev Sanskriti University, and these two PhDs have been air quality modeling and non-conventional solutions through Vedic science, some investigations into the chemical and pharmaceutical aspects of Yagyopathy, studies in pulmonary TB, tuberculosis. And these PhDs have been sort of supported by members of the Central Pollution Control Board and professors from the bioscience and bioengineering department. I welcome everyone on this ज्ञान सभा प्लेटफॉर्म टुडे. आप सभी का इस ज्ञान सभा के मंच पे स्वागत है। और जैसा कि हमने इस वीडियो में देखा कि दिया दैट इज डिवाइन इंडिया यूथ एसोसिएशन is a youth movement of all world Gayatri Parivar and is engaging youth into nation building constructive activities. And this Gyan Sabha initiative endeavor is a part of that nation building endeavor that we are moving ahead with. At the outset, I'll request everyone to pray for the well-being of all, particularly in these troubled times where we are in. मैं सभी से रिक्वेस्ट करूंगा कि मेरे साथ आप एक यूनिवर्सल प्रेयर बोलें फॉर द वेल-बीइंग ऑफ ऑल. We acknowledge the omnipresent, omnipotent, and omniscient Almighty. May the Almighty help us in imbibing divine values and propel all of us on a righteous path. This is, in essence, the crux of Gayatri Mantra. It is Om Bhur Bhuvasvaha Tat Saviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yona Prachodayat. Ladies and gentlemen, we are extremely honored to have with us today Dr. Randeep Guleria, Padma Shri Dr. Randeep Guleria ji, who we know from his very busy schedule has taken out time to be with us today on this platform and share his thoughts for us on this very important topic that is demystifying COVID-19. Dr. Saab, I welcome you once again and thank you so much for taking out time. I'll not take much time, I'll just take 2 minutes to set the theme for today's talk. And very briefly, I'll set out what do we intend to do here today. So we will talk, of course, talk about COVID and the impact it has had on the entire world and our country as well. Likewise, I'll briefly show 2-3 slides to uh, demonstrate what the entire Gayatri Parivar, the establishment and the youth wing have been doing to counter this, and generally what are the activities. So DSVV Dev Sanskriti Vishwavidyalaya is a university in Haridwar, and as we saw in the video, Dr. Kalam went there on the second convocation, and along with Dr. Pranav Pandya, who is the chancellor of the university, they launched a youth movement which would give youth a platform to do these nation building activities. DSVV is reviving ancient wisdom and is confluencing it with modern science, and is uh, committed to do research on a concept called Yagyopathy. And there is a Yagyavalkya Center for Yagya Research, which was established in 2018 there. And it has been doing some pioneer work in the field of Yagya, how Yagya therapy can be used along with modern science. And DSVV is working with the Department of Ayush as well. And prominently in 2016, in a health fair organized by the Department of Ayush, DSVV demonstrated um, the literature on holistic health, yoga, Ayurveda, naturopathy, Panchkarma, etc., as to how they can supplement the existing modern science and how we can explore alternative means of medicine. There have been two PhDs in Dev Sanskriti University, and these two PhDs have been air quality modeling and non-conventional solutions through Vedic science, some investigations into the chemical and pharmaceutical aspects of Yagyopathy, studies in pulmonary TB, tuberculosis. And these PhDs have been sort of supported by members of the Central Pollution Control Board and professors from the Bioscience and Bioengineering Department of IIT Bombay, who are associated with this project as co-guides. Now, the COVID response, when it comes to COVID response, volunteers of All World Gayatri Parivar and DIYA have been engaged in various activities such as distribution of food packets, offering their voluntary services at 5,000 plus centers across world. In addition to it, Gayatri Parivar has a doctors group, a nationwide doctors group which has doctors from various fields, and they in normal times they organize health camps, blood donation camps, etc. But in this troubled time of COVID, they have rendered their services selflessly, which includes treating patients for free wherever possible, operating them for free wherever possible, and providing all assistance that they can during these troubled times. Now, centers have contributed to state, local bodies, and the headquarters at Shantikunj has donated 1 crore rupees to the state government of Uttarakhand. And as I said, millions of food packets have been distributed. facilitation in organizing corona checkups at some of the centers, distribution of PPE kits and masks, gloves throughout, awareness webinars such as this one, global prayers, as I said, because prayers have a strong psychological impact, and there are special online webinars to deal with stress, anxiety, and negative feelings that a lot of us are experiencing during these troubled times, and sublimation of special herbs in yajna for boosting immunity, to boost one's immunity. These are some of the responses that All World Gayatri Parivar, along with its youth wing, DIYA, and chapters across the world, have given to COVID. And lastly, there is a free online mental health helpline center at Dev Sanskriti Vishwavidyalaya, Dev Sanskriti University, dsvv.ac.in, where one can call and deal with all the mental health issues relating to COVID. And there is a free COVID related Ayurvedic consultancy as well, which is running at DSVV. So this is what the background is, the kind of work that All World Gayatri Parivar is presently doing for COVID. And today we are extremely delighted to have with us Dr. Guleria, Padma Shri Dr. Guleria. And I mean, it's my duty to introduce him formally. He's, as we all know, director of All India Institute of Medical Sciences AIMS, and he's consultant to International Atomic Energy IAEA Vienna on issues related to radiation protection. He is associated with World Health Organization WHO as a member of its scientific advisory group of experts, that is SAGE, pulmonologist and the director, as I said, and he's credited with establishment of India's first center for pulmonary medicines and sleep disorders. Dr. Saab is part of the COVID response team uh, of our country, and I mean, we all of us have many questions and doubts related to COVID, and I'm sure Dr. Saab will address these doubts as we go ahead. So, without wasting any further time, I invite Dr. Guleria for his address today and to guide us as to how should we deal with this problem, एंड हम लोग कैसे इससे लड़ें, कैसे इसके जो मिसकॉन्सेप्शंस तरह तरह के मीडियम से आ रहे हैं वो क्या हैं और कैसे हम टैकल करें. आई वेरी हम्बली इनवाइट डॉक्टर साहब.
Thank you very much, Rohitji, and I'd like to first start by my sincere gratitude to the Gayatri Parivar and DIYA Foundation for inviting me to this Gyan Sabha. And I am really impressed by the amount of work they're doing. And I think what this COVID has really shown us is how we all need to really get together and work together as a team in terms of trying to look after our fellow men. It has also shown us the importance of what I call as holistic health. And this is something which our traditions have been saying for a very long time. If you look at Ayurveda and our old traditions, whether it be a good lifestyle, whether it be having good values. And this is something which the pandemic has really brought to fore, that if we have the normal good lifestyle in terms of our diet, in terms of our customs of hygiene, we can really combat COVID-19. Also, I'd like to really say that I'm very impressed by the social activities that the Gayatri Parivar is doing. I think it is very important at this time to support everyone, especially those who are marginalized. We must reach out and help them, because this is the time where they are really going through a very hard phase in their life. And as was rightly said, that because of the lockdown and because of the fear of COVID, there is a lot of stress and mental health issues which we need to reach out to. Children have not gone to school for a long time. Social interaction has really changed a lot, and I think this is something which has caused a huge alteration as far as our own lifestyle is concerned. So I think we need to really start developing strategies of how can we really change all of this. So I will now just start by trying to just try and put slide share on. If I can get my slide share, yes. I hope you can all see my slides.
Yes, sir. We are able to.
Okay, thank you very much. So I shall be basically discussing about COVID-19 and how do we demystify it. So basically, what is COVID? COVID is caused by a coronavirus, which belongs to a large family of viruses. And this viruses causes illness ranging from just what we call common cold, fever, cold, body aches to life-threatening pneumonias. There have been seven types of viruses in this family which have been circulating and causing infection in humans. Four of them are the ones which cause a mild illness like common cold, body aches, fever. But there have been three which have caused severe illness. और ये तीन those are 2004 में आए जिनको हम severe acute respiratory syndrome कहते हैं SARS. SARS started in Southeast Asia, South China, Hong Kong, and then one patient who got the infection and went all the way to Canada carried the infection to Canada, and there was an outbreak of COVID as far as Canada was concerned. But luckily, we were able to contain this viral infection, and there was a good control, and this did not lead to a pandemic. We have another virus which is known as Middle Eastern Respiratory Syndrome, MERS coronavirus. This has been going on since 2012. We have been monitoring this very closely because this is a virus which happens in the Middle East, in Saudi Arabia. And as you're aware, every year many of our citizens go for the Hajj to that area. And because of that, there is always a concern that they may get the infection and bring it to our country and we may have an outbreak. Outbreaks from this have been reported in Europe, in South Korea, and different parts of the world. But this virus also has not caused a large pandemic. SARS-CoV-2 is a new strain which was discovered in 2019, and this has caused a pandemic. जब हम पैंडेमिक की बात करते हैं, then what do we understand by a pandemic? Why does a virus cause a pandemic? Two important things are there when we have this virus. One is it has to be a novel virus, a virus to which mankind has never been exposed. And this usually happens when the virus mutates or when the virus jumps species. SARS coronavirus actually jumped species, it mutated, it jumped species. The origin seems to be from bat. MERS coronavirus, which we have in 2000, which we have there, it has probably a bat origin, but it jumped species through camel. And even for the SARS-CoV, it is believed that it is also through bats or some wild birds that it jumped species. So one is it has to be a novel virus. Second is that the virus has to have the ability of sustained human-to-human spread. The virus should be able to spread quickly from one human to the other. And if it can do these two things, it is novel, so we have no immunity to it, and it can spread quickly from one person to the other, it causes a pandemic. We had one pandemic in which was H1N1, known as swine flu, but it was milder, and we got away with very few deaths, and it did not cause such a lot of problem or disruption as far as SARS-CoV-2 is concerned. We've had pandemics in the past mainly because of influenza, but this is the first pandemic which has happened to mankind because of coronavirus. So on 30th of January 2020, WHO declared a public health emergency of international concern, and in March of this year, it was actually characterized as a pandemic because it had spread to many countries and the cases had grown to a large extent. So the name of the virus is SARS-CoV-2 and the name of the disease is COVID-19. Why are we concerned? Because if you look at the global map, you will find that India has now started having a huge number of cases as compared to other countries. We were able to keep this down to a large extent because of the lockdown. But now the number of cases, if you look at the rolling 7-day average, has increased significantly as far as India is concerned. And we were close to almost a large number of cases, close to 1 lakh cases a day. Also, as you can see, as compared to the other countries, we are having a huge number of cases in terms of newly confirmed cases, and this is also seeing a lot in America and in parts of South America also. Similarly, the number of confirmed deaths has also been on the rise, and therefore this is also a cause of concern, and that is why we need to really see what we all as citizens can do to make sure that we can get over this pandemic and come back to a new or near normal life. Now, what is a virus? A virus is a pathogen that exists between the gray area between living and non-living. What does that mean? So the virus cannot survive without having a host. It goes inside the host cell, it hacks the host cell machinery and forces it to make copies of itself. What the virus does is it goes into the human cell using our ACE2 receptors, and then it hacks into our own machinery and then starts replicating. And that is how it spreads from one person to the other. It does not have the ability to be able to exist on its own. It's important for us to remember, because this is how viruses spread. They are basically not classically living organisms as we would otherwise think them to be. Coronavirus is named because of the fact that it looks like a crown, and this is basically because of the spike glycoproteins, and it resembles a solar corona, or the when you have the eclipse, and therefore the name of it was given as far as coronavirus was concerned. The crown-like appearance is due to projections called spike glycoproteins all over the envelope. So on the envelope you have these projections which you classically see, and they look like the spike, like a corona or a crown. So it spreads from person to person through respiratory droplets, and I'll come to this, which are produced when an infected person coughs or sneezing, and these droplets can land in the mouth or the nose of people who are nearby and possibly then enter the lung. This can also settle on surfaces like fomites, and this can also, one can get the infection by touching these fomites, because then the virus comes to your hands, and if you touch your face with your hands, the virus will quickly get transferred onto your face, your nose and mouth, and cause infection. There's also a debate, can this virus be occurring through inhalation route, and this is believed that it can happen, but it's not one of the major ways of transmission of this virus. Transmission can occur from asymptomatic individuals also, and I'll come to that in some time. So when we look at this viral infections, we will look at what we call particle size, and we look at the size of the particle. If you have a particle size which is more than 5 microns, then these are known as droplets. If the particle size is less than 5 microns, we call them aerosols, and we use this not only in infection transmission. This is the basics of what we use in our drug delivery as far as inhalers are concerned. When we use inhalers for people who have asthma or bronchitis, we look at the particle side, and we look at what is known as mass, median, aerodynamic diameter, and other particle sizes, because the deposition of the virus or drug to the lungs is dependent on particle size. If the particle size is very large, it just stays in the upper airways. Now, also in here, if the particle size is more than 5 microns, these are droplets, and droplets are relatively more heavy. They cannot travel very far off because of their size, and they quickly settle onto surfaces. Some of these droplets, because of evaporation, become smaller in size. They may stay in the environment, and these are aerosols because they become less than 5 microns in size. So what happens is, if you are close to someone who's coughing, these droplets can come onto your surfaces or your face. If you touch something which is close to the person, then also you can get the infection by touching these things. This is something important to keep in mind. So if you look at various activities, and this is looked at by various studies, and this is that if you sneeze, large droplets tend to come down and fall, but the turbulent gas, predominantly with aerosols, can even travel up to a larger distance. On coughing, large droplets usually fall, but usually 2 to 3 meters. The turbulent gas can go on also up to 3 meters, but beyond that, it does not go very far off. So sneezing can lead to more further distribution as far as aerosols or the virus is concerned as compared to coughing. While talking, it's less. While you're talking, if you're breathing out some virus, the virus can come and these droplets can settle, and some of them can go as far as the aerosol is concerned. So important to keep in mind, transmission mode, droplet spread generated while coughing, sneezing, talking, and fomites spread through contact like doorknobs, handles, chairs, and tables. So this is just to give it in a cartoon fashion, that if you have an infected person, he has virus in his throat, in his lungs, depending upon the size of the particle and the distance, and whether he's come in contact with fomites where the particles can survive for a longer period of time, you can have transmission happening as far as COVID-19 is concerned. Now, we feel it is very contagious, but it's important to remember that the number of people COVID-19, which is known as also the R naught, can infect is not as high as certain other viruses we've had in the past. For example, if an individual had measles, it's also viral infection, that person actually infects almost 12 to 18%. Whereas if you have COVID-19, you usually infect around 2 to 2.5 or 2 to 3 persons. And therefore, if we are able to isolate these individuals and make sure that they don't transmit the disease to others, we can break the chains of transmission. And that is why it's important to remember, like I said, the R naught, that is how many individuals can one person infect. And as you can see, as compared to others, COVID-19 has an R naught of 2 to 2.5. It was about 1.2 to 1.6 as far as H1 was concerned. And for other viruses, it has been pretty high. For MERS coronavirus, it's 2.5 to 7.2. So therefore, it's important to remember that this virus is contagious, but it is still manageable in terms of the R naught. But important to keep in mind that once you have an index case, if proper isolation is not kept in mind, this index case will then spread the disease to the household members. They will then spread it to the tertiary contacts, which is community at large. And this is how we start having a cluster development in a locality on an area where one person who has got the infection from outside spreads it to other family members, and these family members then cause other social contacts, spread it to other people, and you start having a cluster of cases. Also, it's important to remember that majority of cases are mild or are asymptomatic, and that's why they don't get picked up. And that's why isolation and quarantine become all the more important. Cases with symptoms are lesser. And then you have severe cases and death, and we always focus on that. But remember, the bottom of the pyramid, which actually is leading to the spread of the disease, is the mild cases or the asymptomatic cases, and we need to keep that in mind. So I think the most important thing in which I'll spend time first on focusing is prevention. What can we do to really prevent the spread of disease, and how can we help ourselves? So it has been shown that the strongest and most effective weapon the society has against the virus is the prevention of its spread. We must work as a team to prevent the spread of this infection. And currently there are no vaccine to prevent from COVID-19. We know how it's spread. I've just tried to explain that to you. And the best way to prevent illness is to avoid being exposed to this virus. And we know that it spreads through close contact, through droplet infection, and also through touching infected surfaces. So there are three important pillars. And if we follow these three important pillars, we can actually prevent the spread of infection. And these three important pillars are: one is physical distancing. It doesn't have to be social distancing. It is more important to say physical distancing. And we must maintain a distance of 6 feet. As we open up the lockdown, this is becoming more and more challenging. And I think offices or workplaces have to develop strategy as to how can they maintain this distance. It could be decreasing the number of people coming to office, having different hours for people to come, or other mechanisms, because we were never used to this issue of physical distancing, and most offices were crowded, but that actually leads to spread of the infection. Third is to make sure that whenever we are touching surfaces, or every few hours, maybe every 3 hours, we wash our hands. That is something we need to keep in mind. So if you touch some surface which you feel is not safe, please use a hand sanitizer or soap and water and wash your surfaces, or make a habit of washing your hands regularly every few hours. And the third important pillar is all of us should wear a mask. And this is something also very, very important. So I will touch upon other points also, 6 in general, but these 3 are the most important that I would like to highlight on. And this is because, like I said, when you cough, if you start looking at the type of particles which are generated through a cough, they can spread to a large distance, and this is how the virus spreads. So this is something that I already discussed, that when you sneeze, there are infected droplets, they infect your hands, and when you start touching people, the virus will get transmitted to you, or if you touch surfaces, the virus will get transferred to these surfaces, and this can lead to infection. So droplet infection and fomites is something that we need to keep in mind. And there are certain activities which are more at risk. The lowest risk is if you're home alone or with just your family members. The moderate risk is outdoor because there is good wind and therefore chance of infection are less. Higher risk occurs if you're gathered in a crowd outdoors, that is a very high risk. And the highest risk is if you have an indoor gathering where there is not good, there is cross ventilation is not good, and you can get a higher chance of infection. And that is why in offices or other places, you must keep your windows open. You must make sure that there is good cross ventilation so that even if you have an asymptomatic person who's infected, the infection doesn't stay in the air for a long time and you're all wearing masks. So the 6 steps, one is hand sanitizer. Hand wash with soap and water is very important, or you can use an alcohol-based hand rub. And you must use 20 to 40 seconds. People would say 40 seconds. And this is basically that you must wash your hands taking that much time. I've just highlighted various important times when you must wash your hand, and keep these in mind, whether it be preparing food, coming from the restroom, leaving a public place, blowing your nose, coughing and sneezing, or caring for someone sick. All of these are important issues, and you should avoid touching your eyes, nose, and mouth. These are the steps which are very important for hand washing. It's not a simple thing that you just wash your hand. It's very important to see that the palm of your hand, the back of your hand, the thumb, the area between your fingers, and also your nails are properly washed. And that is something that we need to keep in mind. And that is also there when you're using a hand sanitizer. I'll see if this video
हाथ
runs.
धोने की विधि में आपको लगभग 40 से 60 सेकंड लगेंगे। गहने, घड़ी और अंगूठियां निकाल दीजिए। पहले हाथों को पानी से गीला करें। अब साबुन दोनों हथेलियों में अच्छे से मलें।
I hope you can see the video.
अपने
this is
बाएं
visible,
हाथ की
sir.
हथेली की ऊपरी सतह से दाएं हाथ की हथेलियों को मलें। ऐसा दूसरे हाथ के साथ भी करें। अपनी उंगलियों से दोनों हाथों के बीच में मलें। अपने हाथों की दाएं और बाएं हथेलियों को आपस में मलें। अब अपने बाएं हाथ के अंगूठे को दाएं हाथ से घुमाकर मलें। ऐसा दूसरे हाथ के साथ भी करें। अपने बाएं हाथ की हथेली की मुट्ठी बनाकर अपने दाएं हाथ की हथेली के ऊपर रखकर पीछे से और आगे से मलें, और ऐसा दूसरे हाथ के साथ भी करें। हाथों को साफ पानी से धोएं और सूखे तौलिए या पेपर टॉवल से सुखाएं। नल बंद करने के लिए उसी तौलिए का इस्तेमाल करें। आपके हाथ अब साफ और सुरक्षित हैं।
So this is just to give you an idea of how to wash your hands. This is also available on our website, and you can look at this video, which is both in English and Hindi, to really give you an idea of how to wash your hands. But also, once you do that, try and avoid touching your eyes, nose, and mouth. Remember, if there is infection on your hands, but you don't bring them to your face, then the infection cannot reach your airways and you cannot get infected. So we must try and make it a habit of avoiding to touch our eyes, nose, and mouth. There are a lot of questions which people ask. Should I be using antibacterial soap to wash my hands? Really not needed. If you use plain soap and water, that is sufficient. If I add alcohol to a non-alcohol hand sanitizer, will this be better to prevent COVID-19? Not really required. Addition of alcohol to an existing non-alcohol hand sanitizer is unlikely to result in activated product. You have to use an alcohol-based hand sanitizer. And can we keep hand rubs in the car? Yes, you can keep hand rubs in the car in a cool and dry environment away from sunlight, and that is something that can be done. Second important step is to cover your mouth and nose regularly, and this protects us from getting infected when we are in office or in workplace. The mask is meant to protect other people in case you are infected, and it also protects you in case other people are infected. So everyone should wear a mask in public setting and when around people, especially when other social distancing measures are difficult to maintain. And you should not use a mask meant for healthcare workers. A simple cloth mask is good enough. But I think this is very important that all of us regularly wear a mask when we're outside. Somehow this behavior has actually come down over the last few weeks, and we have stopped wearing masks as sincerely as we used to. I'll just try and show you why it is important. If you have an infected asymptomatic person, if that person is not wearing a mask, then while talking, coughing, that person is spreading viral particles of different sizes. Now, if a healthy person is wearing a mask, he's protected to some extent. If both people are not wearing a mask, this person will definitely get infected. Now, if both the person who is infected but asymptomatic and the healthy person are wearing a mask, then there is minimal exposure because the chance of the virus coming into the environment and then being inhaled by the healthy individual is very, very low. Therefore, this is something that we need to keep in mind, that masks reduce airborne transmission, and we must therefore be aggressive in containing the infection by everyone wearing a mask. And this is how many countries have actually managed to do it, whether we talk of South Korea, Taiwan, or even Vietnam. The cases have come down basically by using a mask, and it's been calculated and estimated that if everyone in the community wore a mask, we could bring down the number of cases by almost 30 to 40%. That's a huge number, and that will translate to decrease a lesser number of hospitalization, lesser number of deaths. So I think wearing a mask is something we need to aggressively promote among our fellow citizens. It's important how to wear a non-medical mask. These are the steps which basically highlight that you must inspect the mask to make sure it's not damaged or dirty. You must adjust the mask so that it covers both your nose, mouth, and your chin. And you must make sure that this fits you tightly. There is no gap between the nose and the mask or between the side, because you want that there should be no air coming in from the side of the mask. Otherwise, it will actually be less effective. So it's important to keep these steps in mind, and important don'ts also, that don't use a mask when it's damaged. Don't wear it loosely. I see a lot of people who wear masks, but they don't cover their nose. That is ineffective. Your mask must cover your nose and mouth. And also try and be careful that you remove it properly using the strings which hold the mask rather than catching the mask with its cover. Also, cover your cough and sneeze. Whenever you're coughing and sneezing, I showed you the initial video diagram that when you cough and when you sneeze, the virus can travel for a very long distance. Therefore, always cover your mouth and nose with tissue or with even a handkerchief, which you can then wash and use that to cover your cough and sneeze. If you don't have a handkerchief for this thing, just cough into your arm or your elbow. That will also prevent the spread of infection to others. So that is something we must always keep in mind. Then social distancing, which is physical distancing. I've already talked about this, but we must have a physical distancing of 6 feet or about 2 arm lengths. And this is very important in public and outdoor places. And if this is done along with wearing a mask and hand washing, I think we will have won our battle against COVID-19. So keep this in mind, especially before you go, when you're traveling out in public transport, when there is you're traveling to stores selling household goods, and be careful. And as far as activities are concerned, it's better to look at video conferences rather than going into a crowded place, and try and keep as much physical distancing as possible. This is something that we need to keep in mind, that we know how this infection spreads, and by keeping physical distancing, we will be able to prevent the spread of this infection. Avoid touching people. This is something we have to be very careful about. This is changing times, and as we used to do in the past, we should meet everyone with folded hands rather than shaking hands. This will also help in a long way as far as spread of the infection is concerned. Now, do masks work, and does physical distancing work? So this is a study which was published in Lancet in June, which did a systemic review and a meta-analysis trying to see that does physical distancing, face mask, and eye protection really help. And they looked at 172 studies across 16 countries and looked at almost 25,000, more than 25,000 healthcare and non-healthcare settings. And what they found was that if they looked at physical distancing, it was definitely helpful. This is the forest plot, which showed that transmission of virus was lower with physical distancing of 1 meter or more compared with a distance of less than 1 meter. They also looked at face masks, and face mask use could result in large reduction in the risk of infection. This was based on the analysis of the large number of studies. And they also showed that a greater reduction with N95 or similar respirators compared to disposable surgical masks. Remember, they looked at a large number of people who are healthcare facilities. And that's why if you look at the setting, there's a large number of healthcare settings that this has been looked at. They looked at eye protection also in a healthcare setting, and eye protection was associated also with less infection. So now there is a lot of evidence that these things work. It is only that we have to start doing that. And that is why I think these three things that I keep on stressing upon are very, very important. The fifth thing is clean and disinfect your surfaces. And this is something you should do about frequently touched surfaces. It could be tables, it could be a doorknob, it could be light switch, it could be a countertop. Make sure that in offices or in places where there are a number of people coming, that these surfaces are regularly, once every few hours, cleaned with a disinfectant so that the virus cannot survive there for a long period of time. We know that on surfaces, especially metal surfaces or even on wooden surfaces, the virus can survive for hours. Therefore, don't think that no one has come, and therefore in the last 2 hours the virus, you can touch the doorknob. The virus may have been there for quite some time. And if surfaces are dirty, clean them. You can use detergent or soap and water prior to disinfecting them. So these are very important things that you can do, and that you can use simple diluted bleach solution, that is 1 part bleach to 99 parts water. If the surfaces cannot be cleaned with bleach, 70% ethanol can also be used, and toilets and bathrooms should also be cleaned and disinfected with bleach solution. You can use a disposable glove while doing this cleaning so that your hands are not infected. If you can't do that, make sure that once you've done the cleaning, you thoroughly wash your hands so that your hands do not get infected. The sixth step, which is the final step, is monitor your health daily. This is something we have to do during the pandemic. So be alert for symptoms: fever, cough, shortness of breath, or other symptoms of COVID-19. And if you have any of these symptoms, then it's very important that you stay away from office or workplace, or make sure that you don't be the source of infection in your own office or workplace. Take your temperature if symptom develops, and this is something that you need to do. Don't take your temperature within 30 minutes of exercising or after taking medication or having a hot cup of tea. You should take your temperature, which would be the normal temperature in the mouth. And if you have any features of COVID-19, please don't be reluctant. You should get your testing done as early as possible. We have the rapid antigen test, we have the RT-PCR test, and we have the TrueNat and the CBNAT test also. Now, I'll briefly give you an overview. I know that a lot of you are not clinicians, of the pathophysiology and the clinical features, so that you get an idea of what is this virus all about. Now, the important thing to remember is that this is the virus, and I've told you why it's called coronavirus. It enters our body through what it does is attaches to the ACE2 receptors and the TMPRSS receptors. These are present on a large number of cells in our body. And that's why this virus can affect so many parts of our body, because ACE2 receptors are present in the upper airways in the lung, but they're present in the intestine, they're present in the kidneys, and they're present in various other organs. So once it gets attached, it has a direct cytotoxic effect. Then it causes dysregulation of what is known as the reticuloendothelial, the aldosterone system, the RAS system, and this basically through angiotensin 1 conversion leads to dysregulation and causes vasoconstriction and vascular permeability. It can also lead to endothelial, that is the lining inside the blood vessels, damage, and thromboinflammation, that is inflammation or clot formation. And this can lead to the immune system, leading to what is known as cytokine release syndrome. So number of ways this virus can be cause problems, and by the cytotoxic effect, by the renin-angiotensin aldosterone system, by endothelial damage, and by causing a cytokine release syndrome. Like I said, this can infect large parts of the body. We know that it predominantly affects the lungs, but it can have a neurological effect. It can affect the kidneys. It can affect the liver. Some patients can present only with diarrhea, nausea, vomiting, loss of taste. It can lead to a hypercoagulable state. A lot of clotting happens. And we have patients who have suddenly collapsed because of a huge clot which may have formed in the lung. It can lead to cardiac involvement like myocarditis, cardiac arrhythmias. Some of our patients are presented with very low heart rate, bradycardia. It can lead to endocrine problem, and there are patients who present with skin manifestation leading to dermatological problem. So it is truly a multi-system involvement rather than just a lung involvement, as certain other viruses are known to cause. Also important to remember that when you have infection, you have what is known as a latent period, after which you become infectious. But remember, this is the incubation period. So even before you develop symptoms, you are infectious. And it has been shown that almost 2 to 3 days before you develop symptoms, you are infectious. So if I was to have had the infection at point day 0, I would develop fever on day 5, but I would start shedding the virus and spreading the virus to others on day 3, day 4, and by day 5. That means even in what we call the pre-symptomatic stage, you are infectious, and that is why this virus spreads so much. So this is very fascinating. The virus enters your body, it starts invading your cells, it starts multiplying inside your body, in your nose, and it starts shedding and spreading to others, but it has knocked out your immune system and you don't respond to it. If you had an infection, your body should respond to it with some symptoms. It could be fever, it could be body aches, it could be running nose, but this virus knocks out that system, and for 2 days you are actually sort of held, I would say, hostage by the virus to spread the disease but not develop any symptoms till it has spread to other people. And that's why this is a very dangerous virus. So when you look at the clinical profile, you can have an asymptomatic people who are having no symptoms. The virus is in their nose, but the virus has knocked out their system so that they don't present any symptoms, but they are spreading the infection. And a large number of people, it's estimated could be more than 40%. Some studies suggest it could be 80% are asymptomatic, but they are spreading it to others who may become symptomatic and have severe illness. Then you have the pre-symptomatic stage, which I just mentioned. You can have mild illness, moderate illness, severe illness, which can lead to pneumonia. You can have complications like ARDS, acute respiratory distress syndrome, sepsis, and you can have atypical presentation because, like I said, the virus can affect other organs, cardiac, neurological, gastrointestinal, and that's important to keep in mind. Symptoms, we know that majority of time people present with fever, respiratory symptoms, fatigue, body aches, diarrhea can occur, and the loss of taste and smell can also be reported in some individuals. Now, most people, 80% will have mild infection, 15% have moderate infection, and 5% go on to have severe infection in the form of a cytokine storm. The problem is we're not able to predict who will go from one stage to the other, and this is the biggest challenge that we have, that you may have an individual who has mild infection. On the 6th or 7th day, he may suddenly have his oxygen saturation falling, his X-ray showing a patch, and then suddenly he goes into severe pneumonia and then goes into the cytokine storm. There are certain parameters which suggest that there are some individuals who are more prone to severe disease and those who have heart problems, including hypertension, diabetes, chronic kidney disease, chronic liver disease, who are obese, whose body weight is more, who are immunosuppressed, and those who have underlying malignancies. And this is a chart just to show that if you had no comorbidities, your mortality is less than 1%. But with all the comorbidities, the death rate actually goes up. And that is why we keep arguing that we have to try and protect our high risk group, which is the elderly and those who have comorbidities. Mild cases, we are still saying you need to be on home care or in a COVID care centers, and I won't go into the treatment strategies, but we need to see how we can have less stress or strain on the hospital. So those who have mild cases and recover on their own are kept in COVID care centers or home isolation, but are closely monitored because, like I said, we don't know how each individual will behave, and some can deteriorate, and we should have the way of monitoring them so that we can quickly shift them into our hospitals. The treatment predominantly is supportive. There are antivirals that we give. Some of them are given for moderate to severe disease like remdesivir. Some which have less evidence are given for mild disease, hydroxychloroquine, ivermectin, doxycycline, and favipiravir. These are drugs which have shown some benefit, but the data is not that strong. Oxygen therapy is one of the most important treatment strategies, because when they have hypoxemia, if you can correct their oxygen and maintain their oxygen, gradually they start recovering on their own with supportive treatment, and they come out of this severe illness. We know that this causes now increased clotting, as I showed in the pathophysiology, and therefore anticoagulation is an important strategy. And in some patients who go into the cytokine storm, anti-inflammatory drugs like tocilizumab are important also. This is just to give you the time course. When you start having an illness, this black line is the illness. As you go along, you start off with stage 1, which is early infection, where you have a large viral load, but this gradually starts coming down, and 80% of people will get stopped at this dotted line. They will not progress further and will become all right with supportive treatment and with some antiviral drugs. The remaining 15 to 20% may go on to stage 2, which is the pulmonary phase, where they have shadows in their X-ray, they start having fall in oxygen saturation. If they require high oxygen saturation, they go on to stage 2B. In these patients who start having deterioration, steroids are given, and there is now a lot of data, especially good trials and meta-analysis, which shows that steroids actually have a mortality benefit. They save lives. We also give anticoagulants because, like I said, there's increase in clotting. We give antiviral drugs like remdesivir, and in some patients, we also give convalescent plasma. This is all given only in this stage. Again, most patients will stop at this dotted line. Less than 5% will go on to what we call the hyperinflation phase of the cytokine storm. And only in these patients do we give anti-inflammatory therapy like anti-IL-6 therapy, a drug known as tocilizumab. It's important to remember that if we started this anti-inflammatory treatment early, we will actually be causing more harm than good, because we want the body's host immune response to work and kill the virus rather than suppressing it by giving anti-inflammatory drugs early. And that is why timing of treatment is very important when it comes to managing these patients with COVID-19. What about the doing tests subsequently? And this is one study which looked at in SARS-CoV from diagnostic sample, and they looked at 19 RT-PCR positive samples, but only 26 patients had viral growth on culture, and no positive cultures after 8 days or if the CT value was high. What this tended to show was that normally after the 8th to 10th day in asymptomatic people, your RT-PCR may be positive, but you are shedding non-viable or dead viruses, and the virus is now no longer active in your body. And that is why it's not something that we should follow up patients with regular RT-PCR, because it may be just being the RT-PCR picks up the viral material. It doesn't see whether the virus is viable or not. And you may pick up the viral material by the RT-PCR, which is dead virus. This is something that we had also looked at and highlighted, that the real-time RT-PCR does not apply infectivity. And that is why the guidelines got changed. The Indian guidelines now, and since June, suggest that asymptomatic individuals, patients with mild symptom and moderate symptom, do not need to get a test done before discharge. They may continue isolation and they may be sent home after 7 days of a positive report if they're asymptomatic, or 10 days of onset of disease and with no symptoms for 3 days, whichever is earlier. And in moderate disease also, they can be discharged without having a test done. In only those whose immunity is low or who have serious illness should one really do one test to make sure that they are negative, because in immunocompromised people like HIV positive patients or patients with underlying malignancy, they may shed viable virus for a longer period of time. And this is based on a lot of scientific studies which have recently come in. Coming to one issue of herd immunity, we talk of vaccination and then of infection. Herd immunity is if 60 to 70% of people were infected, and by that way they would not be able to, they would break the chain of transmission and not be able to, we would have lesser and lesser number of cases. But we are not sure how long this herd immunity will last without the vaccine because we're not sure how long the titer of neutralizing antibodies stay and whether they're enough. And vaccination is one policy. So we have different timelines as far as vaccine is concerned. And if you look at the timelines for various vaccines, it has taken decades for a vaccine to develop. But for the COVID-19, we are actually developing a vaccine at very rapid speed. And therefore, if you look at traditional vaccine development program, it takes multiple years, phase 1, phase 2, phase 3, and that is preceding that is the preclinical development and licensure. What is being done right now is that we're looking in parallel. We started doing phase 1 and phase 2 and 3 studies simultaneously. We also started large scale production and getting license done so as to bring this down. There is an interest in what is known as human challenge studies, where a hybrid model can also be used, which is known as controlled human infection model. What it means is that once you've done a vaccine trial in phase 1 and you've shown an early phase 2 that you've shown that this vaccine is effective, you give it to people who are having a chance of getting infection and see how much protection it gives them, and therefore they are the ones who become volunteers and get infected, but you have not done all your studies, and therefore this is a human challenge trial. This is ethical issues, but this is being looked at in certain centers in UK. Can we look at these trials, because this will further shorten the timeline for the vaccine to be available. A large number of vaccines are there. This is just to give you a list which was there on 20th of August, where you can see that we have a huge number of vaccines from different areas. Many of them are from the UK, from US, and from China. We also have vaccines from India. We have the Cadila Healthcare Limited, the DNA plasmid vaccine, the Bharat Biotech, the whole viron inactivated vaccine, the Serum Institute of India, along with the Oxford group, and AstraZeneca is also developing their vaccine. And there are additional 139 vaccines in preclinical trials. Finally, I'd like to just focus that COVID is not only a disease where you get all right. There is what we call a post-COVID sequelae. And we're realizing more and more that many patients who recover from COVID continue to develop damage in various parts of the body, which can be long-standing. Some of them recover quickly in 3 to 6 weeks, but in some, there can be lung fibrosis, which can mean that they need oxygen for a long period of time. Some of them have cardiac involvement, so the heart functioning becomes weak. Some people have had stroke. And this is just to tell you that a large number of organs can be involved as part of COVID-19, which can lead to even post-COVID sequelae. And we have started now running clinics to look after these patients. This is a study which was published in JAMA, which looked at post-COVID persisting symptoms. And what they found was, and they looked at patients at 2 months after they had recovered, that only 18, that is 12%, were completely free of any COVID-19 related symptoms. That is more than 80% of individuals had some symptoms as a post-COVID follow-up. Many of them had symptoms which were mild: fatigue, dyspnea, joint pains, chest discomfort, persisting dry cough. None had fever or any illness of acute illness, but some of them had lung fibrosis, which required oxygen at home, or breathing problem. And in about 44%, it lead to poorer quality of life. Therefore, I think we are looking at not only COVID, but post-COVID sequelae, because that is going to be also a huge challenge. Just quickly run through myths, which we have one at a time. One is that this has been around for a long time. It's not a new disease. We know that this belongs to the coronavirus family, and this is a new virus. It's a novel virus. Does this infect older people, and are the younger people also susceptible? This virus can affect everyone. All ages can be infected. Older people can have more severe disease. Is wearing a glove protective? Just let me see. Is wearing rubber gloves while out in public effective? Really not. You must wash your hands, because sometimes wearing gloves gives you a false sense of security, and that can at times cause problems. Keeping your AC switched off, and this is something which a lot of people have worried about. Window ACs and home ACs can be used and are safe as long as there is good ventilation. There should be good air exchanges. When we're looking at big building and central AC, you need to be cautious. You must make sure that there is good air exchanges, the vents are open and fresh air comes in, or you should open a window so that there is good air exchange. And that's because, like I said, some of the virus can be aerosol and may stay in the indoor environment, and either you can have an open window that it goes out, there has to be good ventilation, or use filters or a UV lamp when you're using recycled air, because this can lead to infection transmitting to various parts, and therefore recirculation should be avoided if possible. Should we give up our pets as they may transmit our virus to us? That has not been shown to be true. You should not abandon your pets. If you are symptomatic, maintain physical distancing from pets too. You can transmit the infection to pets. It's an important thing to remember. Taking a hot bath will not prevent you from catching COVID-19. Important to remember, because many people feel that if they take a hot bath, they can get protected. It will not really protect you as far as COVID-19 is concerned. Can gargling mouthwash protect you from infection? There is really no evidence that mouthwash will protect you from infection with new coronavirus. Same thing is regarding as far as drinking very hot water is concerned. Really no data to suggest that drinking hot water will also protect you as far as the virus is concerned. Is it safe to get letters and packages from outside? And this was basically what people are worried about China. But it is actually safe to receive packages as long as you are making sure that you open them properly and wash your hands while you handle packages. So you have a package, you open it, take the content out, dispose of the outer part of the package and wash your hands properly. That is protective. Similarly, does smoking have an effect on the new coronavirus? There's enough evidence to suggest that smoking is not protective. As a matter of fact, smoking can cause more problems. It may actually increase the chance of more severe infection. And if you are a smoker, this is a good time to quit smoking. Drinking alcohol will kill the virus in your throat and prevent infection. This was basically because people argued that if you're able to kill the virus using alcohol-based hand wash, then if you were to gargle with alcohol, it will kill the virus. It's important to remember that the virus in the body is inside cells, and by gargling your mouth, the alcohol will not go inside the cell, and you will not be able to kill the virus. Herbal and homeopathic remedies, again, not much evidence. In general, a good balanced diet, green leafy vegetable, fruits are good for health. I would say regular exercise and yoga is something that we must do. There is a lot of data which suggests that helps and boosts your immune system, and therefore that is something that you should follow up. As far as rinsing your nose with saline is concerned, again, not much evidence to show that this is helpful, and therefore it's not really something that is advocated. Can this new coronavirus be transmitted in hot and humid climates? I think we know that it can, because despite the summer that we've had, the COVID-19 in our part of the world did not show any decline. And exposing yourself to high temperature will not also protect you from COVID-19. And many people say that if I buy medicine, should I keep them in the sunlight for an hour to kill the virus before using them? Sunlight will activate viruses in general, but we don't need to panic so much. We can bring the medicines home and in an envelope, discard the envelope and keep the drug strips with you. It is actually safe to do that. What we've done is we've tried to compile a lot of these things through various booklets. We have this booklet which we've made in English and Hindi for COVID-19. Be careful, not fearful. This was released in mid-March and something that is available on our net. We've had COVID-19 portal also, and if you're interested, the videos that I've showed and many other videos are available. We've had other videos which are basically looking at stigma, how to wear PPEs, how to use or reuse masks, what the elderly should do. And I would encourage those who are interested to really have a look at these videos and the webinars that we've had. We've done more than 50 webinars for healthcare workers and for the general public. We also have a helpline, and this is something that one can reach out to if there is any doubts that you have. The contact COVID-19 National Teleconsultation Helpline. Now, finally, we've made it through worse, so we need not worry, but we need to be careful. And this is what I'm going to show to you, that what happened in 1918 and 19, more than 100 years ago, More than 100 years ago, it was estimated that 20 to 50 million people worldwide died. And this was in the era where antibiotics were not available. We did not have that much of research. Collaboration was not of that high grade. There's a huge number of deaths in the US. As a matter of fact, since 1900 till today, the only time that US life expectancy has fallen or shown a downward trend was during the Spanish flu or the 1919 pandemic. This pandemic also came in 3 waves, and if you after the first wave, people stopped physical distancing, wearing masks, and this led to a huge increase in the number of cases in the second wave, and a subsequent third wave also happened. If you look at data from India, this is data from India of 1918, and we had a huge number of deaths. We had mortality influenza in 1980, 7 million people died. Remember, the population of India in 1920 was only around 389 million. And this is data from the Sanitary Commission with the Government of India during the British time. And the mortality was pretty high at that point in time. If you look at photographs of 1918, it reminds us of today. This is a gymnasium which was converted into a hospital in 1918 flu pandemic. And as you can see, there is physical distancing between beds. There are sheets between beds, and all the people there are wearing masks. Then also public gathering places were ordered closed by leaders in many major cities. There was a shortage of caskets because of the increasing number of deaths, and all police officers also wore masks. Masks actually became fashionable during that time, and this was something that was done by many people in Europe because this was felt it is important to wear to decrease the spread of infection. Even the issue of physical versus social distancing was important, and therefore it was argued that when you're in quarantine, you should still stay in touch with each other. And at that point in time, we didn't have our mobile phones, so landlines were useful. And this is an advertisement by the New York Telephone Company saying that you should stay in touch even during 1918 with your near and dear ones while in quarantine. And schools, churches were all closed as they are today. And therefore, we've been through this about 100 years ago. We had written an editorial about this in 1918, in 2018, when we were having 100 years of the pandemic. And we had really highlighted that we are going to have another pandemic, and India is as vulnerable as it was 100 years ago. So thank you very much. I would just like to conclude by saying the future depends on what we do today. Thank you.
Thank you so much, Dr. Guleria, for that very lucid and simple presentation. In fact, we've got so much feedback on this that the way you explained it simply and you cleared the myths, that is extremely encouraging and helpful. Now, I've got certain questions from the audience, sir, and with your permission, I'll put those questions to you. In fact, many questions have already been answered by you during your discourse, and you clarified a lot of things which we sort of confuse and we are not sure about. For instance, how do we get to know when one is infected? So it's in case of an asymptomatic patient, it's a challenge that we how do we recognize or the symptoms or how do we assess the situation. So I'll take a few questions subject to your availability of time, sir. And one very important question that a lot of people have in mind, and in fact we have got this repeated times, is the CT value. I mean, how important is the CT threshold, particularly when a patient cannot go out and is being treated remotely? What's the significance, and what exactly does it entail?
So there has been a lot of controversy as far as CT value is concerned. CT value means cycle threshold. And this looks at the value once you do your nasal swab or the RT-PCR test. If your CT value is low, that means you have a higher viral load. If your CT value is high, that means you have a lower viral load. So it was felt that if your CT value is less than 20 or 24, then you have very high viral load. And if your CT value is more than 24 or 28, you have less viral load, and therefore it was interpreted that it could mean two things. One is that you will get milder illness, and secondly, that you will be less infectious. So if your CT value is high, you have less viral load, and it was felt that can this tell us that you are less infectious and you are having a less severe disease. However, there are two or three things to remember. One, a lot of studies show that the CT value does not correlate with the severity of illness. So you can have a CT value which may be 25, 26, low viral load, but you may go on to develop a severe illness. The reason why this is important is that you do a nasal swab at a given point in time. The virus is evolving. You may have done it at a time when the viral load has not peaked, and therefore you will get a CT value which may show a low viral load. But maybe if you were to repeat that nasal swab 24 or 48 hours later, your CT value will be different because now the viral load has become different. So looking at one CT value does not tell you how the virus is behaving over a period of time and what your actual viral load would be. And that is why it cannot really tell you about infectivity or seriousness of illness. Sometimes people use it to follow up to see that now my CT value is 20, now it's gone up to 26. So it means that I'm improving. Again, data is not there to show this. So I think we should not really give too much of importance to the CT value.
The next question is in respect of now we see at places such as Mumbai or other metros where people live in very congested conditions, and it may happen that the entire family gets the virus. How do they cope up? How do they manage their food? And is something which is a logistical problem also, but how do they address the medical emergency, particularly when they are asymptomatic and they have to take care that it does not spread to the neighborhood, etc.?
So I think the important issue here is that if everyone in the household is infected, then still it's a little simpler issue because then you don't have to have isolation between one member of the family as compared to the other. On the other hand, let's take a situation where one person is infected, others are negative. Then you have to have very strict isolation in place so that that individual who is infected doesn't infect the other members of the family. So you have to develop one person has to be the caregiver. The person who is infected has to stay in one room with an attached toilet, and he should confine himself to that area. The food that is given should be given by one person who can leave it outside, and this can be picked up so that the physical distancing is maintained. Utensils should be separated and cleaned separately. And you must always wear a mask. Everyone inside should wear a mask so that the infection is not spread. And this person should make sure that all surfaces are cleaned using a disinfectant. So that type of can be done. This is also available on various websites, including the ministry's website, of what is the home isolation method. But the second important thing, so one is protecting to see that your other family members don't get the infection. The second important thing is to see that you don't deteriorate. So you must always stay in touch with your doctor. You must monitor your oxygen saturation. If your oxygen saturation starts falling below 95, that it is 94 or less, then you must immediately consult your doctor or go to the hospital. If you develop any symptoms which are atypical, you start having severe headache, you feel drowsy, or there's diarrhea, then you must consult your doctor and again must go to the hospital. So home isolation, two things are important: protecting others and making sure that you are able to pick up the warning signs so that you can reach hospitals before you deteriorate too much.
So another trend that we have seen at places is people, although they use a mask, but they put down the security points and checks at workplaces, even at private institutions and several places. For security purposes, etc., they are sort of required to pull the entire purpose of wearing a mask. So, how do one wear a mask, and what is it that one should keep in mind while wearing a mask? And what should be what should be the factors which one should keep in mind?
So I think if you have to pull your mask down, it should be done when you're having good amount of physical distancing and in an area where there is good cross ventilation so that you don't inhale the virus. Therefore, if you're doing it at a security point, it's a little dangerous thing to do. You must find an alternate way. When we wear a mask, we must make sure that it's a tight fit. What is the aim of the mask? The aim of the mask is that whatever we breathe in comes through the mask and gets filtered. If your mask is loose, And when you breathe in, when we breathe in, we create a negative pressure. We actually suck air into our lungs. If we create a negative pressure and the mask is not tight, then air will get sucked in from the side, from the area between our nose and the mask, from the area between our cheeks, or if the mask is on those sides without going through the mask. So a mask has to fit doing it in a open area and increasing the chance of infection.
Right. Now, a question that a lot of people are asking, although it's a very broad question and it's on an policy level, but what do you think, sir, between work from home and the unlock that is now in place? Should one avoid going to a workplace as far as possible, or do we now need to come to a point where we start moving things? What should ideally be done to strike a balance? Because I mean, it's very difficult to take a call to do.
If I bring
So,
from
like you
outside,
rightly said, you have to really strike a balance. And non-essential people or people who can actually stay at home and work from home don't come. So we have that in our hospital. Our research staff, if they don't need to come, they work from home. They can stay in touch with their supervisor, and they don't need to come. Our PhD students also don't need to come every day. They can do their work from home. If they have to do an experiment, they can block a time so that they are doing it alone. There's not too much of people in the lab, and that type of strategy can be developed. We are not talking of developing what we are all calling a new normal or a new way of working. For many months, we will have to develop a strategy where we are safe and where we can still continue to have work being done, the economy being up, and for the livelihood and work not suffering, but at the same time making sure that we are protected. So, like I said, physical distancing, we need to work on that in offices also. We can develop an office movement where you have one entry point and one exit so that there's no crossing of people. You enter from one door and you exit from the other door. You can sit in a zigzag manner so that you are not closed, just facing each other. You can put barriers, which could be plastic or glasses, around your office space so that again there is some sort of a barrier and infection doesn't spread. There has to be good cross ventilation. Either the AC duct has to be open so that fresh air comes in. Or windows should be open. Luckily now we have gone through the peak of summer, so we should be able to keep our windows open without too much of heat. And therefore, these are measures that we need to take. We need to be innovative. This is a time where it's challenging for us to see how can we innovate so that our work is done, economy also moves. At the same time, we are able to protect each other.
So striking a fine balance is the need of the hour. You make an assessment of how many people are required in an office, how much is the workforce essential to remain present in the office, and how many people can work from home. So that sort of a mixed balance is required. Uh, a question which is twofold, sir. One is a lot of patients are allergic to certain basic medicines like paracetamol, etc. So they do talk about an inhalation therapy where they take steam, etc. And you mentioned that, I mean, gargles or maybe having hot water may not be a foolproof cure as such. But how is steam effective in dealing with the virus, and especially for those patients who are allergic to certain drugs?
So if you're allergic to certain drugs, like you said, fever medication, you can always find one which are suitable to you. Some asthmatics are allergic to what we call non-steroid anti-inflammatory drugs like aspirin, and we also advise them to take other drugs. There are a lot of home remedies which may help. These include steam inhalation, these include gargling, these include a lot of things that we use like turmeric that people use at home, or other home remedies using tulsi and things like that. I'm not saying that they are harmful or they are of no use. I'm just saying that we don't have enough data. We can use them, but we should not say that this is the only treatment that we'll do if we have an illness. We must use this as a strategy to complement whatever else is needed to fight the virus.
Herbal remedies, Ayurvedic treatment is, I mean, something which can complement the existing allopathic treatment that we are still trying to figure out what it is. So all these are something which we can try, but as you rightly said, it is something which will unfold as we move ahead. But
Correct.
yeah, so my next question, sir, is it's an important question from the point of view of pregnant women, those who are pregnant at this point. What special precautions do they need to take, and what are the things that they should keep in mind, particularly if they are to deliver during this time and also the entire period of their pregnancy?
So we had a lot of concern as far as pregnancy was concerned, because when we had swine flu or H1N1, one group which was at a very high risk was pregnant women. Data as of now does not suggest that the pregnant women for COVID are at a very high risk. They have to take all the precautions because pregnancy itself is a situation where your immunity is altered. Therefore, pregnant women, I would advise them to stay at home, avoid going to crowded places, regularly wash their hands, not mixing with too many people, and at the same time, monitoring themselves closely for any other symptoms. The challenge we've faced at times, and we've had to do this very early in March, is when you have a pregnant woman who comes on term and is COVID positive. So the whole issue of managing pregnancy, whether it is delivery or doing a cesarean section, wearing PPEs was a new challenge that we had early in the phase of the pandemic. We had to form a separate operation theater, separate labor room, but the outcome is usually good. In such positive pregnant women, we will also test the neonate, and there is really not much data, no data to really show that there's significant transmission of the virus from the mother to the fetus or the newborn. But breastfeeding is also safe. So mothers may not worry that much, but they have to make sure that they can protect themselves by the preventive measures that I highlighted in my talk.
There is a time constraint, so we'll just take very short last couple of questions, sir. One is the food that people eat. Is there something which they should do in their diet to include certain types of foods? And people, in fact, have faced difficulties in managing their food, as we discussed. But this specific question is in respect of certain dietary practices which one may include in their daily food to boost their immunity. So, what kind of food would that be?
So my advice is that you must first of all have a good balanced diet, healthy food, green leafy vegetables, fresh fruit. When you get vegetables from outside, clean them properly with warm water and wash your hands once you've done that. And similarly, if you have carrying paper bags, dispose them off. So what you could do is just outside, just as you enter your house or just outside the house, have a table out there where you whatever you get from outside, you clean it out there, wash your hands, and then bring it inside. And then whatever you are using as a cover or as a paper bag or a bag to bring your food, you dispose it off properly. But the food itself is good. You should have a good balanced diet. There is a lot of data which suggests that now with people becoming more focused on good healthy diet, a lot of other illnesses which we would see, which was non-communicable diseases, sugar control, blood pressure control, have also become better. But there's really no definite diet that I would say. People do take a lot of multivitamin, vitamin C, zinc, because some data suggests that that helps to boost your immunity. There's also some data because that may also help to boost your immunity and may help you to fight the viral infection. So supplements can be taken, vitamin D can be taken, but there's no special diet that you need to take. You must take a good diet.
And lastly, sir, when do we see an end to this in the sense? We know it's very difficult to say, and with a lot of vaccine candidates out there, and there's still no clarity as such as to when can we expect a vaccine and how will that be administered, and it's a huge task ahead of us. But uh, where do you see this headed in the sense?
So this is a big challenge, and I think how the pandemic will behave in the next few months is dependent on how we behave. Because if we are able to maintain physical distancing, if we are able to maintain wearing a mask, we will see a decrease in number of cases, and this has been shown in various parts of the world. You've seen that there are very few cases now in Vietnam, in Taiwan, in South Korea. And this is not because they have a vaccine. It's because they were able to do all of these things correctly, and there was a lot of citizen involvement. So if you're able to do that, we will see a decrease in number of cases. If we don't do that, the pandemic will stretch on for another few months before a large number of us get infected, and then the cases will come down. The challenge with the vaccine is, like you said, first of all, we have to have a vaccine which is safe and efficacious, and we have to have data to really show that this is a safe vaccine and effective vaccine. But the biggest challenge is distribution. How do we produce so many large doses? How do we produce so many large doses of syringes, needles, trained personnel to give the vaccine? How do we have a very effective cold chain so that the vaccine reaches the remotest part of the country? And then we make a priority list who should get the vaccine first. Everyone will not get the vaccine on day one. Some will get it on the first month, some may get it 6 months later. How do we decide who will be able to get it at a given point in time? A lot of work on this has already started, but I think this is also a big challenge that the country is going to face.
Absolutely. And it was a pleasure interacting with you, sir. And thank you so much for taking out time today and I mean joining us on this platform. And in fact, I would like to invite you to Dev Sanskriti University, about which we had shown a video at the starting. And there is a lot of work that is going on in terms of combining the ancient wisdom with modern science. And in fact, Harshvardhan ji, Shripad Naik ji, they've been to DSVV and they've shown encouragement to the institution. And we look forward to your guidance and support whenever possible to do such good work for the society. And if you think that we can be of any use, DIA volunteers, because all of us are professionals who take time out of their personal and professional lives and do these endeavors, try to do our bit. So if you think that we can be of some help, please do reach out to us or let us know, sir. And please do try and visit the university once, whenever that is. This pandemic is over, and I mean things are conducible for travel. So on that note, I would like to thank you, sir. Thank you to all the participants, and especially those organizations who have supported us in the Gyan Sabha endeavor all throughout. Law Informants, Podar College, District 3141 Rotaract, Advocate Bala Sahib Apte College of Law, Vidyanidhi, all these organizations who have helped us. And next week we'll have another prominent personality with us, Tushar Gandhiji, who will be talking to us on Gandhian principles. And this is a standard time for Gyan Sabha. Every Sunday at 4:30 p.m. we have been organizing this ever since the pandemic broke, and we try to bring people from different walks of life to have their views on activities which impact our nation as such. And there's another endeavor which we have started under the guidance of Dr. Pranav Pandya ji. Every evening from 6:20 to 6:30, we all of us collectively chant prayers for the well-being of mankind and humanity. We chant Gayatri Mantra. You can join this and say whatever prayer you wish to from 6:20 to 6:30, so that all the COVID warriors out there and all those people who are infected or have suffered a loss, they get strength, because prayers always have collective powers. So with that note, sir, and all
Thank
the
you very much.
participants,
Thank you.
just
And I'd like to definitely pay a visit to your center. Really appreciate the work that you're doing. And I think we all need to come together and work as a team. And there is a lot of good thing that India has, which we need to show the world. So I think this is what your foundation is doing, and it would be a pleasure to be part of it. Thank you very much.
thank you so much, sir. In fact, you are already a part of it, sir. You have come to this platform, and I mean, we look forward to your further support and guidance. So, thank you so much, sir. So,
Thank
I'll
you.
invite everyone to say Shanti part with me. This is for again the well-being of all the mankind. ॐ द्यौ शान्तिरन्तरिक्षगं शान्तिः पृथिवी शान्तिरापः शान्तिरोषधयः शान्तिः वनस्पतयः शान्तिर्विश्वे देवा शान्ति ब्रह्म शान्ति सर्वगं शान्ति शान्तिरेव शान्तिः शामा शान्तिरेधि ॐ शान्तिः 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 सर्वारिष्टसु शान्तिर्भवतु. Thank you, everyone. Thank you.